everyone. Welcome to today's edition of our Stanford live stream. Today we are talking with our APP Fellowship Program, the Clinical Fellowship Program. Getting to meet with the team today, learn a little bit more about what to expect before applications open up here in a few weeks for our 2026-2027 Fellowship Program. So I'm going to get us started by introducing Erin LeMay, who is the Fellowship Program Manager, to just talk a little bit about the overview of the program as well as the specialties offered.
Thank you, Carly, and thank you, everybody. Welcome for joining us today. My name is Erin LeMay, and I've had the privilege of being part of the APP Fellowship Program since 2019, initially as a specialty leader in cardiothoracic surgery for 6 years, and now serving as the APP Fellowship Program Manager. Our emphasis today, as Carly mentioned, is on the clinical specialties. There will be a live stream session next week, same time, same place, that will focus on our administrative specialty. But should any questions arise today, we'd be happy to answer them for you. But today, let's focus on the possibility of you joining our program for the 11th year. We started in 2016, and since then, we've had 52 APP fellows. To date, 89% of our APP fellows are working in the specialty they are trained. And we're really, really proud of that, because that means that we have helped align people to the areas that they want to work in the long term. 55% of our APP fellows are currently working at Stanford, and we really hope to further increase that percentage as well. We really believe that a fellowship program helps with a successful transition to practice. The focus being role transition, professionalism, and acquisition of specialty knowledge and skills. So our hope for you for today is that you'll leave with a clear understanding of our program at Stanford, including the specialties, the application process, and we hope that we've conveyed to you our passion for what we do. Here at Stanford, we do follow a role agnostic approach. This includes APP fellows. So APPs, which comprise of physician assistants and advanced practice nursing, are hired under the same job description and the same salary range. Our fellowship program offers a fully benefited 12-month October to October position. And we acknowledge the excitement, the fears, the challenges of starting practice. We've all been there, especially in that first year. And our fellowship provides guided opportunities to grow professionally while gaining specialty knowledge and skills. And one standout that we're really excited to share is that we are an advanced practice provider, fellowship accredited with distinction program. But what does that mean? That means that we meet high standards for PAs and APRNs that are new to a practice setting. So the American Nursing Credentialing Corporation, or the ANCC, is the professional organization that's outside of Stanford Healthcare, and they've thoroughly reviewed our program, evaluated and affirmed our structured approach to supporting APPs in ways that really says that we provide a specific framework, a lot of resources, and support to successfully guide APPs in their first year of specialty practice. When an APP joins us in October, they have been licensed by the state of California. They've been certified by their profession and credentialed by Stanford Healthcare. And so on day one, they are fully practicing providers. We have 5 clinical specialties, and our clinical specialties focus on the inpatient and outpatient settings, and they work throughout our healthcare organization. So each specialty offers a broad exposure to that specialty, a certain skill set, and within our program, we offer a broad exposure to the organization itself. So cancer care, which was our inaugural specialty starting in 2016, we've had 17 fellows to date, followed closely behind by cardiothoracic surgery starting in 2018 with 15 fellows to date. Electrophysiology, established in 2021, has had 8 fellows and is a leading first-in-class specialty program. Inpatient Neurosciences started in 2023, which does include a little bit of outpatient exposure, has had 4 fellows to date. And Orthopedic Surgery, which is currently in its very first year, has 1 APP fellow. All of our APP fellows work in collaboration with really national and world-renowned experts and professionals many of whom are APPs themselves. So I could talk all day long about our APP fellowship program, but hearing directly from our APP fellows themselves about their experience is highly valuable. And so I would like to pass the mic to our EP Electrophysiology alumni, APP fellow, Sarah Nordman, to share with you how we are as a program, maybe a little bit about what a day in the life of an APP fellow is with both rotations and didactic conference days. Sarah.
Hi, everybody. My name is Sarah Nordman. As Aaron was saying, I just graduated from the EP Fellowship just in October, so a couple months ago, and I've just been starting now. I think that the fellowship is something really unique and a really great experience. I knew I was interested in EP, but then once I got into it, I really fell in love with the specialty and I really enjoyed it. I think something that wasn't touched on when I first did the live stream, when I was interested in it, was really the friends that you make and the support you get from all of the other specialties and everything you learn. We get to meet every single Wednesday for our fellowship with everyone else. And I think that that's something that's really special that a lot of other fellowships do not offer. And you just get to learn about other specialties. You get to see how they all kind of overlap within the medical system. And you get to do case studies, you do journal articles, and then you also do a big project on something that, you know, you're specifically interested within your specialty that you kind of work on throughout the year. And I'm actually still working on my project, so it continues on if you stay on. And I just think it's really unique, and the group of people are amazing. All of the specialty leaders are extremely supportive, and so overall you just have a great support system all around. I can't speak for everyone, but I know for all of the preceptors that I was allowed to have, they were all amazing and all willing to help and very patient, especially since knowing we're new providers and this is all a new experience for us. But you really take a dive into the deep end into kind of your own specialty and what you're interested in. But, you know, I think that Diana can give a little bit more on that. She's one of our new fellows who just started the program just a couple months ago. So Diana, I'll pass it over to you to touch a little bit more on kind of what it's been like to be a new fellow right now, just starting out.
Thank you, Sarah. My name is Diana Wendell. I am the APP Fellow for Inpatient Neurosciences. I just started this past October, so I'm currently in the thick of it. The program itself, it has been a great assistant in helping me make this transition. So a little bit of my background, I was a bedside nurse here at Stanford for 14 years, working in the neurosurgery unit, and so I worked at the bedside up until I started the fellowship. It's very normal to go into the fellowship being nervous about making that transition from bedside into provider. And this program has really, really helped me make that. It's helping make that transition a little bit smoother, I think, than if I had not been in the fellowship. Like Sarah mentioned, the camaraderie is amazing. I mean, there's 5 other fellows in my cohort. And something that I really value is while I'm in the inpatient neurosciences rotation and I'm learning a lot about neuroscience, I'm also being exposed to all the other specialties. So like last week I had a case study in cancer care. This morning I had a lecture on how to read an EKG. And this afternoon I have a lecture on AKI. And so next week we have a journal club with that our administrative fellow is going to be presenting on. So you kind of get a little bit of all the different specialties throughout the entire fellowship, which I really value because it kind of helps you. It just kind of augments your knowledge as a provider in your specific specialty to be able to add to that. The leaders within the fellowship have been very supportive. They're constantly asking me, how's it going? Is there any advice we can give you? Anything like that. It's just been a very good experience and a very, very supportive environment. And it feels safe to talk about the challenges I've been having during this transition, in addition to just feeling like they're my family and I have support when I need it. So I will pass the mic on back to Carly, I believe.
Take back over. Now I'm going to introduce Ann Owen, who is our specialty leader in orthopedics, which is a newer opportunity in our APP fellowship. So I'm excited for her to give us kind of more insight to that particular program and kind of let you know why you want to come join our specific fellowship program within that specialty.
Thank you, Carly. My name is Anne Owen. I am the specialty lead for orthopedics. Very excited to share with you what we have in store for the next year and what's happening this year. But before I get started, I want to kind of shadow or add to what Diana and Sarah has talked about in regards to what makes this APP fellowship so special. So we have 6 leaders, the director being Kelly and the manager being Aaron, and each specialty lead really carries out a special curriculum that provides a comprehensive and hands-on educational training for all of our fellows. But what's really unique about it is the camaraderie. So we get together on Wednesdays. We talk about case studies, journal articles. During our didactic days, we have sim labs as well as wellness activities. And we are really a good cohesive group to work with, which makes it fun as well as educational. So I really want to emphasize how unique that is to our program. So now to orthopedics. I'm excited to show you basically that we partnered with our resident education program and our current fellow, Senta, who is going through it at this point in time, gets to physically be in their core rotations, which means that they are being talked to by our subspecialty surgeons, as well as people who are flown in as regional and national experts. She has core rotations with our residents, as well as participates in grand rounds. This is very special and unique as she is able to be educated alongside our residents, our ortho residents. In addition, during the summer core program, she will be able to have hands-on firsthand experience with our cadaver labs, as well as really practice in our newest facility for our lab techs and play around with all of the equipment that they have set up for our residents. And so this on top of our didactic days and all of the training that she gets is, I think, a really good well-rounded program. So currently right now, she has 6 rotations, core rotations, which comprises of physiatry, joint, spine, foot and ankle, hand, sports med, as well as mini rotations for ultrasound guided injections, bone health, and our very own acute care clinic, which is very similar to an urgent care and orthopedics. And so all of these, I think, will provide a good educational as well as hands-on training for transition to care in orthopedics. So very excited to have anyone ask any questions at the end of this, but excited to also hear from you at the end. Thank you.
Well, a little glitch there. I'm going to now pass the mic to Ashley Beal, who is our senior talent acquisition consultant that oversees kind of the recruitment side of the APP fellowship program. She's going to be giving information on what to expect during the application process, what's required to be considered for the program, what documents you should start working on and collecting before applications close in the middle of February, and then also giving you just kind of some of the basics. Here's what to expect as far as interviews and onboarding. Here's the benefits that Stanford offers. So when you're making your decision on which fellowship programs to apply to, you can make the one that's the best fit for you. And hopefully she'll give you a couple of really good selling points here. So Ashley, I will turn it over to you.
All right, awesome. Thank you. And Carly, if you don't mind, I have a couple of slides I wanted to reference. Thank you, everyone, for attending today's live event. My name is Ashley Beal, and I'm the Senior Talent Acquisition Consultant supporting the fellowship program here at Stanford. I'm excited to walk you through the application process, important dates, and what you can expect as a candidate for the 2026 and 2027 cohort. Let's start with the timeline. Applications for the 2026 to 2027 fellowship will open in early December. From that point forward, you'll have until February 15th to complete your completed application. After the application window closes, our team begins review and qualified candidates will be invited for interviews. Those interviews are typically held between mid-March and early April. Following interviews, we finalize selections and extend offers in late April through early May. For those who accept, your official start date will be October 12th, 2026. This is a full-time one-year fellowship that runs through early October of the following year. Next slide, please. When you apply, there are several components that must be included for your submission to be considered complete. First, you'll need 2 letters of reference. These may come from leaders, physicians, supervisors, or other individuals who can speak directly to your performance and potential in a leadership or administrative capacity. Because many applicants wait until the last minute, the best advice I can give is to ask for your letters early. Second, we require an unofficial transcript. It doesn't have to be sealed or mailed directly from your academic institution. An uploaded PDF is perfectly fine. Third, please upload your most recent resume or CV. And finally, you'll be asked to respond to 5 short answer essay prompts. These give us insight into your interest, your motivation for applying, and how you think about clinical work within the healthcare environment. Now let's talk about what the role looks like from an HR and benefits perspective. The fellowship is a full-time, 1-year fixed-term position. You will be a salaried employee with access to the full range of Stanford healthcare benefits. That includes medical, dental, and vision coverage, disability benefits, retirement plans, and generous paid time off. Most fellows end up with roughly 36 days of PTO over the course of the year, depending on accruals and holidays. The compensation range, which is updated annually to stay competitive, aligns with the salary band for advanced practice provider leads. What that means in practical terms is that your compensation is highly competitive within the Bay Area healthcare landscape and reflects Stanford's commitment to supporting fellows in a meaningful way during your training year. We're often asked what happens after the fellowship ends. While the fellowship in itself lends a 1-year appointment, our hope is that fellows will continue to grow within Stanford Healthcare. Many of our past fellows have moved into APP lead roles, manager roles, or strategic administrative positions here in the organization. While continued employment isn't guaranteed, the program is intentionally structured to prepare you for leadership opportunities here at Stanford or within other major healthcare systems. Before I wrap up, I want to share a few tips for creating a strong application. Start early, especially on your letters of recommendation. Use the essay prompts to tell us who you are, not just what you've done. Be intentional about why the clinical fellowship is appealing to you. And finally, don't hesitate to reach out if you have questions during the process. We are here to support you. Thank you again for joining us today. We're truly excited to meet this year's applicants, and we look forward to reviewing your materials. I'll now hand it back to Carly to continue our session.
You are welcome to drop your questions in the chat for anyone on our team, whether it's questions for Ashley about our benefits in the application process. If you want to talk to Erin more just about the overall program, questions about how our fellows got involved in the Stanford community, what are ways that you connect with our other APP fellows. And we also have Kelly Bugos, who is the director of the APP Fellowship Program, here as well to connect with you, answer any and all questions. So I'm going to kick it off and get started. I think I'm going to pick on Anne. Being a leader, Anne, what is a way that you help new APP fellows that are new ones that just started here in the last 2 months? How do you help them integrate in the Stanford community and feel like they have a sense of belonging and purpose?
That's a really great question. Thanks for asking. First, we create such a good environment for them. So we pick the good leaders, we pick the good preceptors, and really try to integrate them into our subspecialty. For example, in our subspecialty in orthopedics, what we've done was we presented prior to her coming in to all of our surgeons, all of our APPs, as well as our ancillary staff. They know all about our fellow prior to coming in. So when she's in our clinics, practicing alongside our APPs, our surgeons, coming in to greet our front desk personnel, they already know who she is and they've welcomed her. They know to, because of Stanford CI Care, they know to care for her as well as our patients. And so that's the first step in kind of integrating our APP fellows. Second is providing an environment where they can thrive. And so we, as leads, have created our curriculums based on what we think is best in their learning, the type of learners that they are, number one, or what environments they would thrive in. And so all of this is taken into consideration prior to any of our leads, not our leads, but our APP fellows coming into our subspecialties. This is our focus. Our focus is to provide a safe learning environment as well as a fun learning environment for them. And so hopefully all of these things that we pre-plan integrates them in and allows them to thrive.
Thank you so much, Anne. I always love to highlight just the community here at Stanford and why so many people come to Stanford, choose to stay here, and continue to build their careers even after the fellowship is done. While you guys are thinking of your questions to give our attendees today, I do want to hand the mic over to Kelly, who is the director of the fellowship, just so you guys get to see her face today and hear about this program that she has nurtured for so many years and pours her heart into and absolutely loves being a part of.
Hi, Carly. Thank you so much. And hello to all of you out in the audience. I want to piggyback onto what Anne was just saying about how there's this culture of introducing the fellows way before they get into a rotation. I'm actually over at our continuing education center today, helping to train the preceptors for the fellowship. And a number of them said, gosh, they know all about Senta, our orthopedic APP fellow, just because Anne has introduced them and she hasn't even started a rotation with them yet. And so as Carly, thank you for your compliment. And yes, this is work that I absolutely love because it creates an environment of safety where people can try new things out, make mistakes, and still progress on and becoming the APP they want to be. One of the questions we get asked a lot during these live stream events is about mentorship. And I just want to comment on that. At Stanford, you may know that every APP who is hired with less than 3 years of advanced practice experience goes through a formal mentorship program. And that's often called out as a best practice. But in addition to the people you see on screen today, like Anne and Aaron, as specialty leaders or program managers, we are all together on Wednesdays, mentoring all of the fellows and mentoring each other. So the mentoring is really built into everything that we do. And I also want to say that while you see me here in a formal outfit with a formal background, a lot of the work we do is just very normal work. So yes, I serve as the director of the program. I also am a preceptor for the cancer care fellows. My specialty practice is in cancer survivorship. And I'm also the specialty leader for the administration specialty. So we wear many hats. And again, we feel like this helps to form an integrated approach to supporting the fellows to be the best they can be. Back to you, Carly.
Thanks so much, Kelly, for just giving us a little bit more of an overview of you. And now I'm going to kind of pick on Erin here a little. Erin, program manager, what is for in a candidate? What makes a fellow stand out when you're looking at those applications and deciding who you want to move forward with for the fellowship program? Is it something pretty simple? Are you looking really at those essay questions? Are you looking at their experience? Is it how they present themselves and really let you know who they are through their cover letter? Give me a little overview here.
Yeah, thanks, Carly. That's a great question and talking point. It's D, all the above. One question that we tend to get is, what if, should we apply to one specialty, or is it okay to apply to two? And, our advice is apply to one, because what we are really looking for is we want to select fellows who are clear with their desire to work in a specialty field. We're meant to be a stepping stone and to help you launch in your professional journey. And as I mentioned earlier in those percentages, 89% of our prior fellows are still working in that specialty. And so, we want to see that passion in a specific specialty. And so applying to one is preferred. But what we're looking for in potential candidates, other than the passion, and we review the essays closely, we review your CV, we look review the letters of recommendation very carefully, because we not only want to know your passion, we want to kind of get to know who you are as well. Being a fellow, it's a tough year. You're rotating, every 6-ish weeks to a new place, and so establishing rapport and building relationships is really important. And so what we look for in candidates is adaptability, flexibility, because you are going to have to be moving through this busy year, through different places, meeting a lot of different people. And so, connection is really important. Being curious. We want our APP fellows to, dive into each rotation, to get excited about projects or QI or processes that might need improvement. Get excited about a skill set or a procedure that they might get to have exposure to. And so, being really curious and open-minded and asking a lot of questions are things that we kind of seek out in our candidates. I don't know if Kelly or Anne, you want to add anything to that?
I'd like to add. So just add on, I think that Erin makes great points. But also we look into your history, like he says, background. You want to be able to practice in a setting that you're really passionate about. And so looking into, your history, looking at the fact that you have been consistently in the subspecialty that you want to seek out is something that we also consider. And so, thinking in what you want to practice in, that's something that we take a look at as well.
Thank you so much, Anne, for adding on to Erin. One of the things that I've noticed when doing this streaming event previously, or talking with potential fellows when I'm at different conferences, they always ask, what's day-to-day life like? Like, what is it, what would my week look like once I'm in there? So I feel like the perfect person to answer that is one of our current fellows. So Diana, I'm going to pass it to you. And if you can just kind of give us a visual. What does it look like a day in the life of a fellow at Stanford Healthcare?
Sure, I'm happy. I think Erin and I think that's really important to keep in mind because it does change every week. I've had rotations in the clinic. I've been at the hospital in Pleasanton. I'm going to be at main campus in a couple weeks. I'll be at other clinics throughout the organization. So that piece of flexibility is really important. Each week, can be a little different, but generally on Wednesdays, I know Sarah mentioned we have like our didactic day, which is it's a day dedicated each week to just the fellows. We come together in the morning and we usually have some sort of teaching or a meeting with Kelly and Aaron. Like this morning, it was EKG lecture from our EP specialty lead, which was really interesting. And then in the afternoon, you meet with your specialty lead. And then in the afternoon, you're usually, sometimes we come back together for different types of teachings and educational opportunities. Sometimes we are doing our own like specialty related modules or resident teachings. I've attended quite a few of those on Wednesdays. It's mostly what it's like. And then the rest of my week, just depending on what days my preceptor is working, I'm currently at the hospital in Tri-Valley. And so I'm following him for 8 hours and also taking care of my own patients at the same time as a provider through the fellowship. Thank you, Carly.
Thanks, Diana. Well, I guess I want to then switch over to, hopefully she won't mind. Sarah, I'm going to pick on you. So you're a alumni, but what are some things that once you went through the fellowship, what are some things that you learned that you're so grateful for the experience?
I mean, at least for me personally, I think the overall experience is something unique, especially for EP. I think it's something that it's like one of the only in the entire country. So I don't think I would have gotten as much hands-on learning as that I got. Especially for electrophysiology, it's kind of learning an entirely different language. And so having that support for an entire year is something that I think I needed and really benefited from, but also it really prepared me for feeling like I was ready. And kind of right after I finished the fellowship, I've kind of been able, with some support from all my coworkers, to kind of be on my own and kind of show that, you know, like I learned a lot from this fellowship. I've grown a lot, and I can do it, which is kind of crazy to think about. But I think it's so focused for the fellowship, and I think that that's so unique, and they really want you to be supported and they want you to learn. And also, like, it's hard, it's busy, you do a lot, but you know, it's, if you manage your time well, like you can balance, like have a good, decent work-life balance. And I think it's just all about how each person manages their time and tries to decide on how that works best for them. Obviously, it's not a one shoe fits all. But I really felt like I was able to learn a lot, challenge myself a lot, still have time to be around my friends and family. And we had a lot of amazing lectures from our specialty leaders, from my coworkers. We did a lot of different training to get ready for devices, to get ready for cardioversions. And so I think it's just, you learn a lot, and I don't think you realize until the end how much you truly did learn and grow. And it's wild, but it's really fun and it's really exciting. So yeah, thanks, Carly.
Thanks so much, sir. I love hearing just current perspectives from our fellows, even alumni, just to give that personalized view of what our fellowship is. And for anyone that's watching, no question is too late. So even if you hopped on late and you think maybe we already discussed it, drop it in the chat on which platform you're watching us on. We're happy to get those answered. You have these guys here, you know, at your beck and call to answer your questions so that you feel fully confident applying to our fellowship program. I'm going to kind of pass this back over to Diana and then over to Sarah to discuss our communication series that we offer for our fellows.
Thank you, Carly. So part of the didactic portion of the fellowship is this communication series that's run by one of our amazing spiritual care providers, Emily, who I've only had 2 of them, but so far it focuses a lot on communication, like how to communicate with others, how to learn how to communicate with others. And this last one we had last week was about how to communicate with others while also embracing who you are as an individual, which I really enjoyed, kind of learning how to leverage your own strengths to help other people leverage their own strengths, which I really enjoyed. I'm going to pass the mic over to Sarah, who's completed the series, who probably has a little bit more input after she's completed it.
That's great. I think that just to add on the communication series, it's, you know, being able to talk to your coworkers, being able to talk to your patients, but also the practicing and the knowledge of how to have those really complicated conversations that I think you will always have in your career, no matter what specialty you go into. There's always going to be some really tough conversations that will be had with patients, family members, friends, colleagues, other staff members. You know, it's just having a nice tool set in your bag to be like, okay, these are the things I can pull from to say, wording to use. You'll do some like kind of practicing to help you as well. And I think you don't realize until you need to use it how beneficial it can be, and allowing you to have that knowledge to have those really tough conversations, which no matter what, they're always going to be complicated, but having some support and kind of a backbone, a little like to help you guide you, can make it so much easier, not just for the conversation, but also, you know, to protect your piece as well, which I think is something that is hard and taxing in the healthcare field. So.
And I'm just going to add on to Sarah and Diana's point. So our communication series, I think, is so important. And the reason being is, you know, it teaches us intra and interpersonal communications, like they said, to deal with our work, our colleagues, our patients, but also it makes you think a lot about yourself and how you are as an individual and how you can grow as an individual. So not just, you can take this, not just, you know, at work, but also in your home life and who you are. And for me, this is my first year with a fellow. I was with the fellowship last year, and each time I sit in these communication series, I really do take away a lot of knowledge about my colleagues, as well as myself, and that really is empowering. And so talking about transition to practice, I think that that's something that's very, very unique also to this program, and it really does prepare you to give you a little bit more empowerment and the ability to know what to say in certain situations, and how to deliver that message. So I think that that's really, really nice to have prior to going into practice on your own.
Thank you so much for sharing those insights, Anne. Because our viewers are being very quiet, I thought of a couple more questions, just thinking from a potential candidate that I kind of wanted to ask. Aaron, I'm preparing you. So you came from out of state. You moved literally across the country to work at Stanford Healthcare. And I know that there's so many different fellowship programs throughout the United States. And there is someone out there in a different state, probably on the East Coast, thinking, do I want to move coast? Do I want to go from the East Coast to the West Coast? That's such a big move. I'm giving up everything I've ever known. What would you say to those that are on the fence because of the location, or because it just seems like you would be starting over? What would you tell those fellows about why it's okay to just make the particular program?
Yeah, I lived in Florida for many years and worked as an APP there, and made the decision to move out to the West Coast. It is scary leaving your comfort zone, whether it's from a different position or from an RN to a new provider or graduating school as a PA. So, you know, change is hard, and leaving your comfort zone. But what I will say about Stanford and how special it is, so I've been at Stanford since 2017, is Stanford is so supportive of the APP practice. We have a Center for Advanced Practice, which not all healthcare organizations have. we also all answer to APPs. I don't remember the percentage, but I think 98+% of APPs directly report to another APP. And so just that hierarchy of APP leadership and APP support and resource and structure is so valuable, and it's just visualized and you know, it's just really helpful to advance one's career professionally, personally. If you have an idea, you find someone will support you. If you share your passion, there's someone out there within Stanford that will help you get to that next step, whether it's a project, whether it's you know, doing research, whether it's diving into a new skill set or a procedure. And so I just really like to highlight the level of support for APP practice, not only from APPs, but from physicians, from other professionals, from high level executive leadership and operational leadership. And so that's why I've been here almost 10 years, and I don't plan on leaving. So just the level of support is really strong here, and the connections made are lifelong. And you know, again, I could talk all day about our fellowship program and about Stanford.
I always like to just hear someone else's perspective, but just having that confidence to make that leap. And I mean, it's a testament. You came, and a lot of times people, they make a year or two, and then they go back to, you know, their community, their home, and you're 10 years later and you're still thriving. So it is a testament for what Stanford has to offer for our APPs. And we are starting to get to the end of our session. And so I wanted to give Kelly one more chance just to talk about something that she is so passionate about this APP fellowship program. And, you know, Kelly, I guess one of the things, this program has evolved so much since it started, and we just recently added a new specialty. I just feel like this program is just going to continue to grow and be recognized for all of the amazing achievements and all of the fellows that are coming to the program. What do you see for the future of this fellowship program? What has you excited about the next chapter of the APP program?
Oh, thank you, Carly, for that question. I think we're on the trajectory toward our future, which is to continue to strategically add specialties so that we can support APPs transitioning to practice successfully, happily, in these sometimes very specialized areas. We have a lot of support from our organization for this fellowship. Even in tough financial times, we've been able to fund the positions. And we see that the fellowship not only gives the fellows this opportunity to be able to be immersed in specialty learning and learning alongside terrific role models and world-renowned experts, but the fellowship's also giving back to the organization. And some of the ways we do that is with the advancement of our fellow graduates. Sometimes it's the way the fellow projects are contributing to increased patient access, decreasing length of stay when they're inpatients, and overall improving the patient experience. And as you've heard today, we are all learning along the way. And so the fellowship has elevated all of our practice. So I hope that when you're considering your next steps in your professional career, that you will consider whether Stanford APP Fellowship Program is going to help you to become the best APP you can be. And with that, we look forward to reviewing your application.
Thank you so much, Kelly. We did have one question just come in, and I want to make sure we get to it before we officially log off. And Anne, I'm going to pass it to you. Someone asked, is this program for FNPs? What is kind of the basic requirement to be a part of the program?
Absolutely. Yes, you can apply as an FNP. And so for our clinical subspecialties, you should have at least less than 1 year of experience. And so it should be up in the APP fellowship page, the career page, to look into the application process. I hope that it's up. Erin, do you know if it's up at this point in time?
I don't. Maybe, I don't know if Ashley might have that answer.
Okay.
Not at this time, not quite yet.
Okay.
I will step back in and close this out. For those of you that are interested, it will be posted on our careers page. It will be on the main careers.stanfordhealthcare.org website. You're able to just type in APP Fellowship. All of them will pop up. You are also able to check out our APP Fellowship landing page that if you just check in the top screen here, you will see the QR code that will take to our APP Fellowship landing page, which is a wealth of information. You'll be able to learn more about the different specialties, what to expect with rotations, type of patients that you're going to meet. All of those application requirements will also be listed there, as well as important dates from the time applications are open to the time the offers are made. There's also a link for our APP Fellowship LinkedIn page, which is a great asset that highlights our APP Fellowship program, shows the different community outings that we all do, and just how everyone kind of comes together to build their own community within the fellowship program. We appreciate all of you being here today, being a part of this streaming event. And for those of you that are interested in the APP Fellowship Administration Fellowship, we will be here at the same time, same place next Wednesday. So feel free to join us, ask all your questions. And then if you are looking for information, depending on which platform you're on, I will be including Ashley Beal's information so you can reach out to her with additional questions that you may have about the application, onboarding, as well as just the requirements that are needed. So again, thank you to everyone for joining us today. We had a great time with you over the last 45 minutes, and we really hope to see everyone have their application in here pretty quickly. So thank you again, and we will see you on the next streaming